Good day, fellow viewers, and welcome once again to Fitness Trail. Today, join me as we take a tour through COVID 19. The topic being, do I have COVID 19? COVID 19 is a respiratory tract infection or respiratory tract disease. And respiratory tract infection are infections that obviously affect the respiratory tract. The respiratory tracts are made up of the nose, sinuses, mouth, throat, which is also known as the pharynx, voice box, which is also known as the larynx, windpipe, which is also known as the trachea, and the lungs. So any infection that affects all these parts is known as a respiratory tract infection. The eye could also be a portal of entry for respiratory tract infection because the eye is connected to the nose by the NASOLACRIMAL apparatus. Respiratory tract infection could be caused by viruses, bacteria, fungi, and many other microorganisms. Different microorganisms can cause different symptoms or the same symptoms. Coronavirus is a large family of viruses. In humans, it tends to cause mild respiratory infections or severe respiratory infections, such as SARS, which is severe acute respiratory syndrome, MERS, which is Middle East respiratory syndrome, or COVID-19. Coronavirus, as we have already heard, started in Wuhan, China in 2019, thereby the name coronavirus disease, COVID-19. The disease started in Wuhan, China, in a suspected seafood market that sold live animals, and the virus found its way into humans through zoonotic transmission. That's from animal to human, and from there, human to human transmission occurred. The main mode of transmission of COVID-19 is via respiratory droplets. That means when a person sneezes, coughs, or talks, the viruses are being emitted. And then, as we have heard, for a virus to complete its cycle, it first needs some few things, which includes an infectious agent, in this case, the coronavirus. 2, a reservoir, which is the person who houses the virus initially. Then 3, a portal of exit. So the point at which the person coughing, sneezing, talking is emitting the virus. And then the mode of transmission, which could be inhalation of the aerosols directly. That's primary aerosolization, or it's settling on surfaces and then you touch it with your hands and then touch the portal of entry, which is the mouth, the nose, the eyes. Yes. And then, so the next point is the portal of entry, and then the susceptible host, a person who can house this infection. The estimated exposure after incubation is 45 days, but they can occur from 2 to 7 days. Usually 45 days after exposure, you can start exhibiting symptoms. The symptoms of COVID-19 include, but not limited to, fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and then the loss of taste or smell. It's not only one of these symptoms that can conclude that you have COVID-19. It could be a combination of these symptoms, fever and then cough being one or few of the peculiar ones. Also, other symptoms include nose blockage, diarrhea, cough with heavy sputum or mucus, also nausea and vomiting. When you need to visit the health center or call the hotlines, that's 11192. Yes, when you find trouble breathing or constant pain or pressure in your chest or confusion or difficulty in waking up or blue tinted lips or face, note that there is no one set symptoms that rules out COVID-19. It's a combination usually. So you don't need to panic though, but then you need to look out for the red flags that shows that you could have the virus. Relax. Follow the measures, the safety measures, frequent hand washing under running water. Use the hand sanitizer. Avoid touching your mouth, your ears, your eyes, your nose. Also, avoid touching your face. Try as much as possible to keep good hygiene, and then you know that you be on the right track. Stay safe, stay at home, don't panic. Make sure that you try as much as possible to distance yourself from suspected people or from people in general when you commute from your homes to places outside. Thank you very much. This is Fitness Trail, and relax for more interesting videos. See you.